Hi there, I'm Dr. Anthony Tang from the Breast Clinic, and I'm a breast cancer surgeon, and I've been in private practice now for many years. And with me today, just to have a chat, is Dawn, who is a clinical psychologist with Annabelle Psychology. Dawn, you want to say something else?
Okay, so I'm a psychologist, and as part of my work, it's really our privilege to journey with patients who've got some personal difficulties, and that includes serious major illnesses such as breast cancer or other forms of cancer as well.
In my practice, when I first give the news of breast cancer to someone, obviously it's quite shocking. Sometimes they are a little bit more prepared because they already think that something is wrong. Sometimes they're totally unprepared. Later on, they come to accept what's going on. Then there might be a little bit of grief kind of thing, and therefore, they start crying in the clinic. And of course, then I need help from my nurses as well to help to comfort them. And together with my nurses, we always try to tell them that this situation, although it needs various forms of treatment, is always treatable and curable. So I think it's very important to give hope and to tell them that, look, this is not like a death sentence, from days of yore, from a long time ago, but nowadays it's definitely curable. Obviously, we need to do certain steps, certain modalities need to be used to cure this disease, but there is certainly hope, and that's what we try to give them.
I think, just picking up from what you shared, Dr. Anthony, shock is something that can, be very difficult for the patient to experience at the start. But it's actually a psychological defense barrier that can then, even denial, right? That can then allow them to gradually process this big piece of news, at least how it seems to them, in more feasible, digestible bite sizes as well, that they can gradually then come to terms, come to some acceptance with as well. I think some of the other clients or patients that we tend to see would sometimes also experience some sadness, grief or anticipatory grief about what's to come. Or there can also be some anxiety, especially for some people who might start wondering what's the worst. But I completely agree with you. I think that it's essential to give them hope as well.
Do you see a lot of patients at this sort of like early stage and they just get this kind of a news that they have breast cancer? Do you see them at this stage?
A handful of them. Usually in the past, and especially when I was working in the public health system, we'll see them in the later stages of illness. Usually when it's progressed and it's quite advanced or in the palliative stages. So I think that's when it's harder to come to terms with, especially when the prognosis is not good.
And for my own benefit as well, because usually, as I said, what I mainly do for them is to give them hope, to tell them that this is definitely curable. We can lead them every step of the way. But besides that, is there anything else I could do in a clinical setting to help them prepare for the various forms of treatment, say chemotherapy or surgery, which is to come?
I actually think that whatever you're doing is so important. It might look simple, getting someone to comfort them or assuring them that you're with them at every step of the way. But this is the kind of social support. It's so fundamental for them to process this grief and to feel less alone, in this in this state of distress. And that's really important.
Absolutely.
I also think that sometimes breaking down the information, it might require repetitions and asking them repeatedly if they've got any questions would also be helpful.
Absolutely. So I always tell them after the first time I meet them with this kind of news that before the next visit there'll be tons of questions running through their mind. I often tell them also to record it down. Because very often with this kind of shocking news and all that, they would sometimes forget, right? What questions you want to ask and everything.
Yes.
So I always tell them, record it down somewhere, and the next visit, you'll slowly go through all those queries and whatever's on your mind, whether it's on the medical side or on the psychological side or physical side or whatever it is, then we'll have a chat about it.
Yeah, I think that what you're doing is, absolutely fantastic. Okay.
Oh, thank you.
I personally had a relative who was a breast cancer survivor, and she, as well as a caregiver, would go into the consult and not be able to fully process whatever the doctor shared, and then forget bits and pieces of it because, just the mental state of the stress that they were in. And it would sometimes be helpful for them to take notes or to even have a third person that they trust who's a bit more, in a calm state of mind and a bit more neutral to kind of remember important information. And we found that, helpful along with the medical support.
Right.